Hi, I'm Dr. Arviv at Arviv Medical, and I'm here to talk to you guys about a new treatment that we brought in a few months ago, and it's called the Genius from Lutronic. And basically, most of you have heard of microneedling, and most of you have heard of radiofrequency. This is combining the two modalities. So what we're doing is we're using this gold tip, 49 tip needle that goes down into the skin and then delivers the radio frequency under the skin. The nice thing about it, great for all skin types, great for acne scars, texture, improving collagen elastin, helping with tightening the skin, and it doesn't actually remove the top layers of the skin, so the downtime is pretty minimal. A little bit of swelling, a little bit of redness, but nothing crazy. It is also a very smart device, so we can select, the gender, the age of the patient, and the skin type of the patient, and then we can go into this automatic mode that will preset the basic studied protocol for this treatment. Once we select the demographics of the patient, then we can select the area that we're treating. You can do forehead, you can do mid-face, lower face, you can do neck, and you can also switch to different parts of the body if you want to do arms, chest, thighs, lower limbs, and abdomen. You can actually use this to treat some of that crepey skin that you want to get rid of. We do usually recommend 3 sessions, 1 month apart, and we are going to do a little demonstration of how the treatment goes. We do 3 passes on each area. Each pass will target a different depth and a different energy level depending on the patient. We usually start with the lowest settings and then we kind of work our way up. So the second session will be medium to high settings. The third session will be a little bit higher. We're starting with the lower face here, so I'm going to select the lower face for the patient. And this patient has had CO2 before, she's had other lasers before, so we don't have to start with the lowest settings on her. We can start on a little bit higher settings. So what I'm going to do today is I'm going to about double the minimum energy that I would normally do. And we're going to do lower face. So we'll start with 28. We're going to go 2 millimeters, and then we're going to go 1.6 millimeters, and then we're going to go 1 millimeter. So 3 passes, each one from deep to superficial. This is the tip. Okay, so start with the lower face. First pass, I'm going to double the energy level. So we're going from 2.5 millimeters, 2.2 millimeters, and then 1.5 millimeters. And each one we're going to double the energy. So I'm going to start with 28 millijoules. Go ahead, Jackie's going to take over.
Thank you. I'm so excited.
And once I push start, the first pass, the first pulse will just release this cap off so that this area remains clean and sterile. The patient's been adequately cleaned, and we are going to start the treatment here, and then you can come in and take a closer look if you want. And you can see the needles coming out. Did you see that? And you can see how now it's warning me that I didn't deliver the proper amount of energy because it's a very smart device and it's measuring the water content in the tissue, and so it knows that it's delivering very little energy because we're not in the right surrounding, we're not in the right environment. And normally we will do some overlap. How's that? We're gonna go down. It's not the most comfortable treatment. And then we're gonna come back up. You wanna do nice pressure. And just work your way row by row. And then once we finish this side, we can either choose to do the second and third pass on the same side, or we can just go through to the other side and then come back to do the third session. So this is the microneedling. The needles go in, and then the radio frequency is delivered once the needles are inserted. And you can see a little bit of the pattern of the needles already, and you could even see some of that pinpoint bleeding. When you go deeper, you're going to get a little bit of pinpoint bleeding. I don't expect bruising necessarily, but in some patients you might experience some bruising depending on how frail their skin is and how vascular it is. So this is normal. And then because, especially since, we're going deep, once you get into the more superficial, we're 2.5 millimeters, so we're in the deep dermis. Once you go more superficial, you know, you're less likely to have that vascular layer getting targeted.